Hi, my name is Dr. Maria Muto, and I'm a doctor of physical therapy at Iron Health. I'm going to go over knee pain, specifically runner's knee. And you guessed it, yes, this happens to typically runners, but it doesn't have to just happen for runners. You can get it all the time because it's pain in front of the knee, and this would happen from essentially overuse. So if we just talk about the activity of running is a very repetitious, stressful, impactful movement. So if we are landing and creating a lot of impact, that would just cause some irritation to the tendon and the muscle that are involved in this diagnosis. So basically, runner's knee, in its lay terms, if we use like the medical terminology, most often it's patellofemoral pain syndrome. And that just means that the tendon that connects the patella to the quadricep, it's the patella quadricep tendon into the quad musculature. So if we essentially create some sort of inflammation of that tendon, the tendon can't carry the loads that it normally can carry, and things kind of just go out of whack, and then that throws off the pressure changes, and we can get pain with our knee. And that mostly can happen when we're loading our knee. So say, for example, we're going up the stairs or going down the stairs, we're loading and bending the knee at the same time, which would cause pressure in front of that area. So what do? Basically, with any injury, so this is useful information for almost any overuse or any injury that you have, more or less, is that you want to deload. You want to reduce the stresses that go on in that area so your body can soon then recalibrate and understand that it can withstand those loads again. So, if you need to, if it's extreme and you need to go off weight, you can put a brace on there. If you really need additional support using a cane or an assistive device such as a crutch, that would be useful. And if you feel like you've lost out on any range of motion, you want to try to regain that motion as much as you can. Once you feel like you have mastered that phase of rehab, you would then progress, making sure that you're incorporating strength and mobility work. And you're also trying to target not just the muscles that relate to the knee, but muscles that relate to the hip and the core, just so you have, again, more of a balance centered, so everything extending out from that would then be strong and stable. What could also be helpful is shoe wear, and I did do a video on the differences between a more supportive shoe and a minimalist shoe. So if you are having some pressure changes and differences, you can get a more supportive shoe that has a support in the heel to kind of help offload and distribute the forces a little bit more supportively. That is something that could be useful for this diagnosis and for runners or individuals who are on their feet all the time or who like to walk. But more or less, injury or runner's knee is basically trying to calm down the area that's irritated and then create motion and strength along with that, and including the muscles around the joint. So try these tips out and see if that can help you if you're suffering from knee pain and if you're a runner.